Hello, everyone. Hello, Liz.
Oh,
Welcome. I think we will go ahead and get started. For those of you who joined us on time, thank you. And I anticipate that others will join as well. And if you are watching the recording, welcome, welcome. My name is Kathryn Sabella, and I'm excited to be here with you all and with my colleague Liz to tell you more about the Center for Community Inclusion and Reflective Collaboration. The title of our presentation today is Enhancing Community Participation Among Young Adults with Serious Mental Health Conditions from Disadvantaged Backgrounds. Let's see. All right, so I'm Kathryn Sabella. I am a co-director of the CIRC Center, and I'm assistant professor of psychiatry within iSpark. Within iSpark at UMass Chan Medical School. My training is actually as a sociologist, so I don't have any clinical training, yet my career has focused on conducting research aimed at improving the outcomes of young adults with serious mental health conditions, with an emphasis on social causes and social consequences of living with a mental health condition during young adulthood. Liz, would you like to introduce yourself?
absolutely. So great to see everyone here today. My name is Liz Thomas. I'm an assistant professor in the College of Public Health at Temple University. I'm also an investigator within the Temple University Collaborative on Community Inclusion. This is a center that focuses on promoting community inclusion and community participation among people with psychiatric disabilities. And of course, my work within the center really focuses on young adults with serious mental health conditions and promoting their community inclusion. So I'm thrilled to be teaming up with Kathryn on this new center focused on young people with serious mental health conditions from disadvantaged backgrounds. We'd like to know a little bit more about who is here as well. So a poll should be appearing on your screen here in a second. We'd love to know more about your connection to young people with serious mental health conditions.
Yes, thank you. It'd be so great to know what perspectives are represented here in the virtual space. And I see Rishab from India introduced himself in the chat. So if you want to throw in the chat where in the world you are calling in today from, that's also exciting to see. So feel free to do that as well. We'll give this poll just another maybe 30 seconds and then ask our colleague Dee to share. Awesome. Karen from Colorado, thanks for being here. Awesome. Kentucky, Portland State University, but working in New Mexico. Awesome, awesome. Great. Thanks, Dee, for sharing the results. How fun to see where everybody's calling from. Now there's too many. I can't just say them all out loud, but I appreciate keep them coming. So it looks like we have quite a few service providers here, some research colleagues, awesome, and some young adults and family members who we love to have along with us, and policymakers and other. Awesome. Of course, we couldn't probably ever make this list completely exhaustive, and we realize that some of you might wear multiple hats in terms of your roles. So we appreciate you responding with these categories, and thanks for letting us know where you're coming in from. Awesome. All right, so I'm going to get started. And Liz and I are really going to toggle back and forth. We are co-PIs on the CIRC Center, and this is what we do. We do a lot of collaborative work here. So sometimes I will be primarily presenting, and sometimes Liz will be as well. Let's see if this slide goes. Otherwise, I might have to have Liz do it. All right, Liz, I think we're going to go old school here.
Sure.
Awesome. All right, so just a quick acknowledgement. We're here talking about the CIRC Center, which is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. And this center is also co-funded by our friends at SAMHSA, the Substance Abuse and Mental Health Services Administration. The contents of this presentation do not necessarily represent the policy of NIDLR, SAMHSA, or other federal partners. We have no conflicts of interest. And just a note, as Liz and I introduced ourselves, this is a collaborative endeavor between Temple University and UMass Chan Medical School. And Liz mentioned the collaborative on community participation at Temple. I'm also the director of the Transitions to Adulthood Center for Research at the medical school, and we'll be describing a little later what this partnership looks like. Next slide, please. What we're going to be doing today, we have 90 minutes, which should be plenty of time to kind of set up a little bit about what we already know, what the general field knows about community participation and young adults with serious mental health conditions and disparities among young adults from disadvantaged backgrounds. And then we really wanted today to introduce the CIRC Center to you by describing what went into creating this application, describing the activities that are within this grant, and then also highlighting ways that we can collaborate, we can provide technical assistance, and highlighting ways we get information out to you and others in the field. So before we go too far, real quick, I know you all are still putting in where you're coming from, but another question I have for you that you can answer via chat a little bit is when you hear community participation, what examples of community participation come to mind when you think about young adults with mental health conditions, and young adults from disadvantaged backgrounds? So if you have any thoughts of when you hear that term community participation as it pertains to young adults with mental health conditions from disadvantaged backgrounds, throw it in the chat. If you aren't familiar with the term community participation, put that in the chat too. We'll definitely be explaining it a bit more. Awesome. So civic engagement, absolutely. Working or going to school, 100%. Those are ways in which young adults participate in their communities. Volunteering, yes. Church, religious affiliations and participation, community involvement, community activities, leisure, great word, leisure. What do you do for fun? Recreation is another word that's sometimes used. Hobbies. Hobbies is another great one. Connection is a great word. Supporting other family members. These are great, great, great. Ooh, Tracy, thank you. Online communities. Yes. When you think about young adults, you think about participation in online communities. Adults too, but we might expect to see slightly different patterns in young adults. Awesome. All right. Well, I love that there's a bit of a baseline here. So let's tell you a little bit about what we do know about communication or community participation, excuse me. With that, Liz is going to take over for a minute.
Yeah, I love hearing about all of these examples and hearing about the ways that you all define community participation. We define community participation as this choice and action that individuals make to be active and valued roles in their communities of their choosing across a variety of domains in their lives. And you all mentioned a lot of these domains. Work and school, certainly very important to young people, but also family relationships, friendships, romantic or intimate relationships, religion and spirituality, if that's important to people, recreation and leisure, going to the gym, artistic activities, hobbies, civic engagement, that could be advocacy, voting, volunteering, community organizing, all of these dimensions of life that are really important to most of us and can be kind of critical components of our own health. We also thought it was important to share with you a bit about why we believe community inclusion and community participation are critically important. I mentioned they're important for our health. But one reason is that community integration, which is this opportunity to live in the community and be valued for our uniquenesses and our abilities like everyone else. This is recognized as a right that was defined by the Americans with Disabilities Act, and then was reinforced by the Supreme Court's Olmstead decision in 1999 that found that unnecessary institutionalization was a form of discrimination prohibited under ADA. And Olmstead really set off a lot of policy actions in the federal government from that point. For example, President Bush put forward the New Freedom Initiative in 2001 and the New Freedom Commission report in 2003. And all of these kind of policy actions really underscore the notion that community integration is a legal right. But we believe that the importance of community inclusion and participation goes beyond just this legal perspective. Community participation is also a medical necessity. And this Well Together tool that you see on the screen is something that was developed by the Temple University Collaborative in collaboration with an organization in Australia called Wellways, in which it includes some of this evidence and support for the notion that community participation is a medical necessity. So I encourage you all to check that out if you want to know more. But just briefly, the argument for medical necessity comes from a number of theories and concepts out there, like the World Health Organization's International Classification of Functioning, Disability, and Health Framework, or the ICF, in which participation is really viewed, again, as a critical dimension of health and health functioning. And according to ICF, participation refers to involvement in any sort of social situation. That might be being a student or going to church, synagogue, or mosque, or voting, anything that really involves social interaction and meaningful activities. Of particular relevance to our center, we believe that community participation is especially important among young adults. This is a developmental phase in which people are using community participation as a way to test out personal interests, possible social roles that they may want to have in adulthood, and their own identities. But we also know that the onset of serious mental health conditions tends to occur during late adolescence to young adulthood, and that this can significantly interrupt or delay the pursuit of community participation interests. For example, it can delay attainment of educational achievements that are needed for competitive employment down the road. And we know from research that young people who don't receive treatment designed to minimize these illness-related disruptions are at greater risk for health problems and poorer functional outcomes as they grow older. So I think this really further supports that notion that community participation is a medical necessity in young people in particular. Finally, focused on life goals, so people's interest in work or school or relationships. This focus on life goals among mental health providers is viewed by young people as a facilitator of their engagement in mental health services. One of our colleagues and investigators within our center, Alicia Luckstead, did a qualitative study with young people who were participating in coordinated specialty care, early intervention, and psychosis services. And this is exactly what they said. When they were supported in doing the things in life that really mattered to them, that kept them coming back. So a focus on community participation might promote meaningful involvement in services and longer-term retention and care. We wanted to share a little bit with you about some of the research that we've done so far about the interests of young people as it relates to community participation and the state of community participation among young people. So a few years back, notably pre-COVID, the Temple University Collaborative did a study, a focus group study with 11 young people who were either participants of an early intervention and psychosis program or a residential program for young adult men. And these groups, the purpose of these groups was really to elicit a broad range of community participation areas and interests that were considered to be important to these young people. And participants identified a total of 16 different areas of community participation, or those domains that we showed you on a previous slide. And they mentioned 58 specific activities falling within these domains that were important to them. Something that really stood out to me from this study was the importance of online communities, as Tracy pointed out. And I think that has grown even all the more important since COVID, where a lot of us are turning to those online communities as a way to connect with others. Something else that was, a standout to me from the study was all of the different iterations of sports that we heard about, and all of the different artistic activities that were important to young people. Heard a lot about these things in particular. We also did a study that we call our developmental study, in which we compared the amount, importance, and sufficiency or satisfaction with community participation among different age groups. So there were 879 participants with serious mental health conditions in the sample, 105 of whom were classified as young adults between the ages of 18 and 30 in this case. And there were three main findings pertaining to young adults. So one was that young people tended to value and spend more time working and going to school than older individuals. This isn't terribly, surprising from a developmental perspective, but what was surprising was that young people reported overall a pretty small amount of time in these activities. So on average, they reported only about 5 days a month working and only about 2 days a month going to school. We also found that young adults indicated that things like running errands or going shopping, going to a place of worship, and spending time with family and friends were very important to them. And then finally, compared to those older, young people were less satisfied with what they were doing in the community, or the amount of participation that they were doing in areas that were important to them. So only about 36% of important areas were considered to be done enough. So I think this really underscores the need to support young people further with doing the things in the community that really matter to them.
Thank
I think
you.
Kathryn was going to take this one.
Yes, thank you. So that's a great picture, and I'm so grateful to Liz and Mark Salzer and others at her center for kind of leading the charge in some of this more recent research on what does community participation look like for young adults. And we have to call out the elephant in the room at the same time, is this post-COVID or since COVID context. We know that all of our lives were impacted by the pandemic, especially in 2020. And young adults, developmentally and culturally, where they were at in their life, were uniquely impacted in many ways. We saw magazine covers, just like this one shown here, highlighting the lost kind of transition to adulthood for many young people, and the loss of those traditional milestones of graduation, moving into college, etc. So we know that young adults with serious mental health conditions during the pandemic, we have some ongoing research with colleagues at UIC showing that they frequently reported, not surprisingly, disruption in areas of work, residential situation, living situation, intimate and social relationships, and school. And we also saw that young adults with mental health conditions who were in poorer physical health and poorer mental health were significantly more likely to experience multiple role disruptions, indicating that they might be even more at risk for long-term negative outcomes. It's really unclear how COVID has impacted and continues to impact community participation for all age groups. But particularly young adults who had a critical developmental period when it comes to navigating towards young adulthood and the milestones of adulthood, completing school and work, and all of those career development activities that really tend to impact significantly long-term outcomes. Next slide, please, Liz. So just taking a pause here because I neglected to mention it earlier, but I did put in the chat. If you have questions, please put them in the chat. Liz and I are going to keep an eye on the chat. We have some colleagues here helping us do that. Depending on where we are in the presentation, we may take the opportunity to pause and follow that question and discussion point, or we may push it off till the end where we hope to have some time for more question and answer and discussion. Also, if you are, tuned in right now and you want to share with us in the chat what you were thinking about what was just shared, are you surprised by anything? Do you have any reactions? Anything like that? Please, let us know as well. A colleague is saying, yes, during the pandemic, we also saw many more people develop mental health concerns and or have increased symptomatology of their existing mental health conditions. And there was also some homelessness, increased rates of homelessness, substance use. You think of the youth who were transitioning out of foster care at those times and what they might have been experiencing. So it's a complicated picture for many, many young adults, and especially young adults from various disadvantaged backgrounds, which is the focus of our funding. Next slide, please, Liz. So defining disadvantaged backgrounds, if I asked you all what, to name a few disadvantaged, marginalized, or otherwise vulnerable populations, we might get some discrepancies. NIDLR, the funding agency here, defined for us and for the proposal several disadvantaged backgrounds and identities that they were most interested in. And this includes young adults of color, BIPOC or racial ethnic minoritized youth, also youth that identify as lesbian, gay, bisexual, transgender, queer, intersex, asexual, and more, also commonly referred to as the LGBTQIA+. Many young adults actually like the term queer more. We're also learning that some young adults don't love the term BIPOC. So I'm just mentioning that too, because I think culturally, how young adults identify with some of these labels is important to consider. We also include in that disadvantaged background category young adults in other circumstances, those living in rural areas, those living and or adversely affected by persistent poverty or economic inequality. And again, youth involved or with previous involvement in justice and or child welfare systems. Importantly here is this idea of multiple marginalized identities, this concept of intersectionality, meaning people are not siloed. And many of us, if you think about some of the identities, these social identities that you occupy, you need to check all that apply. And the check all that apply may look different in different contexts. The experience of being an LGBTQ plus youth living in poverty in a rural area is going to look different than an LGBTQ youth living in an urban area who maybe has darker skin color. I mean, all of the variables are here. And so what we really wanted to keep our eye on in all of our activities is that the possession of multiple marginalized identities and those sources of disadvantage impact all of this: mental health, community participation, all levels, opportunities for community participation, how they participate, all of it. Next slide, please, Liz. So in thinking about what work needs to be done in these areas, we wanted to make sure, again, we understood what the picture of community participation looked like from young adults or among young adults with disadvantaged backgrounds. And not surprisingly, there are really some concerning prior research findings that we wanted to be mindful of going into this. We know that when it comes to social relationships, friendships, or otherwise, young adults of color, LGBTQIA+ young adults, and those involved in the foster care system experience numerous barriers to social connection. That can include lack of understanding from others regarding their identity, stigma associated with some of those identities, and also feelings of shame, inferiority, discrimination, things like that. Education, another really normative milestone of young adulthood, and we want to see young adults advancing their education in young adulthood. But we know that economically disadvantaged youth and young adults and those from racial and ethnic minority backgrounds are less likely than the general student population to graduate from high school. Employment is, of course, another important factor in young adulthood. but justice-involved young adults often lack the job readiness skills and work experience that they need to obtain and or maintain employment. And then again, stigma, discrimination, barriers to job applications with a criminal background are a real problem. And then civic engagement, this idea of being involved in voting and political activities and any other kind of civic duties or activities in your communities. We know that structural inequities can prevent marginalized young adults from participating in civic life to the same degree as more quote unquote privileged peers. This is even considered this civic engagement gap. And I want to highlight this slide is on general population, not just youth with mental health conditions from these disadvantaged backgrounds. So again, layers of social identities leads to that intersectionality and the experience of possessing multiple marginalized identities. Next slide, please. Thank you. So we still don't know a lot. So we know all of that. I mean, that's a lot. And what's the saddest part of all this is that we really have few interventions that exist specifically to improve community participation outcomes for young adults with serious mental health conditions from marginalized or disadvantaged backgrounds. And we don't know whether the interventions that do exist and or were designed to promote community participation address the needs of these youth with potentially multiple marginalized identities. So we have lots more to learn. On the next slide, I just want to also comment is as we were pulling together this application, we were also thinking about, and we'll talk in a minute about social justice and where and how social justice fits into research as we conduct it in our day-to-day lives as academic researchers. So there's something called the quant-crit movement. Quant is short for quantitative, which is a type of research. Crit is critical analysis. And the quant-crit movement is a growing movement within academic research especially, that encourages researchers to use a critical lens to assess if and how methods of research that they employ are influenced by historical, social, political, and economic power relations, as well as their own biases. We are humans trying to do objective research. And research should be working towards equity and supporting social justice when possible. This hasn't always been the case. I think we can say that overall, in the last few years, we've all awoken to some of the systemic and significant barriers to full social justice in this country. And research traditionally, I myself do not consider myself an interventionist, but I have colleagues who were trained as interventionists with the idea of you develop an intervention or a program and then you test it. And they were trained to develop and test interventions with the broadest target population, i.e. the majority population, in mind. Go through the cycle of testing it with that majority population. And then later, if it is shown to be effective with that majority population, adapt it for the diverse or more marginalized subgroups. Now, I don't think this training was really ever questioned until recently, where recently, following the quant-crit movement, we know that that traditional development pipeline actually delays interventions that could reach potentially marginalized subgroups who actually need it more than the majority population. So again, that assumption of developing and testing interventions in and of itself with the majority population could be seen as an example of perpetuating some of this power and privilege that is strongly rooted in our systems here in this country. So this pattern of increasing the awareness of historical, social, and political and economic structures and power relations, it's really important that we start doing that more in traditional social science research methods. So that is a commitment Liz and I take very seriously. Okay. So I'm seeing some commentary in the chat. Keep it coming. Questions are welcome. But now we're going to turn from what we know or what the science was telling us prior to the start of the CIRC Center. And now we're going to get into telling you all what we plan on doing in the CIRC Center, which started on the September 1st of this past year. Next slide, please. So we are, the CIRC Center stands for the Center for Community Inclusion and Reflective Collaboration. Importantly, a lot of thought went into naming this center. And we will talk about our participatory involvement, but just to say this center was named in partnership with young adults with mental health conditions from disadvantaged and marginalized backgrounds. And we are proud of the name of the center for broadly representing and emphasizing community inclusion and this process of reflective collaboration involving multiple individuals from different perspectives in the process. But the overall goal of this center, which is a 5-year research and training center, is to serve as a national leader in state-of-the-art research and knowledge translation activities in order to significantly advance community living and participation outcomes, which we refer to typically as community inclusion, among young adults, which is 14 to 26-year-olds, with serious mental health conditions from disadvantaged, vulnerable, and marginalized backgrounds. It's a mouthful, but if we go to the next slide, we just wanted to again kind of lay out for you that this is a collaborative effort between UMass Chan Medical School and Temple University College of Public Health, specifically longstanding rehabilitation research and training centers funded by NIDLR, the Learning and Working During the Transition to Adulthood, RTC here at UMass Chan, and the Temple RRTC on community living and participation for people with serious mental health conditions, both within these sub-centers focused on the Transitions to Adulthood Center for Research and the collaborative at Temple. And out of this collaboration was born CIRC. And Liz and I are just so thrilled to be working together on this. Next slide, please. So I want to take a moment to go through our objectives. First, our goal or objective is to generate new knowledge, meaning do research, create new knowledge regarding developmentally appropriate interventions that maximize community living and participation. Developmentally appropriate really means taking into consideration the developmental stage of young adulthood. Liz's center has done years and years, almost 2 decades worth of research on community participation and living outcomes among adults with mental health conditions. But young adulthood is a unique stage of life. Secondly, we want to generate new knowledge about systems and policy issues that affect community living and participation outcomes. Again, it was really important to Liz and I that we weren't just looking to try to move the needle on individual factors that could improve community participation, that again, we have to contextualize that individuals live in these systems and policy systems and communities that they themselves already may be racially marginalized, have systemic barriers, policy issues that are getting in the way. If we just focus on improving, quote unquote, resilience of youth to participate in their community, or other factors that really are focusing only on the individual, we're doing a disservice, and that we really need to be looking at the systems that these young adults live and breathe and work in. And thirdly, we want to share this information out in various ways and quickly by providing training, dissemination, and technical assistance activities to a multitude of players in this field. Young adults themselves, family members, service and support providers, researchers, policymakers. This webinar is a perfect example of that. We were thrilled to see the diversity of perspectives represented here. So thank you for that. Next slide, I think, is going to go to Liz to share.
Yeah, so we wanted to take a few minutes to share with you all a bit more about the guiding values, principles, assumptions that we use to develop our center and upon which we're going to be assessing it along the way. The first is this notion of disability justice And Kathryn talked about the idea of intersectionality in a previous slide. But disability justice really focuses on intersectionality and recognition that the experience of disability is shaped by a person's multiple social identities and some of those social institutions and systems that can contribute to the experience of disability. All of our research projects, as Kathryn mentioned, really do attend to these multiple sources of identity and multiple potential sources of marginalization that people experience. And our interventions really seek to address needs around those issues. So our second guiding principle here is the social model of disability, which really recognizes that disability isn't something inherent to a person, but it's really a result of a poor person-environment fit. And so we could spend lots of time developing and evaluating interventions for individuals, but if we don't take into account the environment or systems issues, policy issues, we're really missing a critical part of factors influencing a person and their ability to participate in the community. And so all of our projects do attend to environmental issues such as stigma and discrimination, and key systems and policy issues that impact participation. And third, as Kathryn recognized, we really do take a developmental perspective to our work, recognizing the unique milestones, experiences, and needs of young adults. And the substantial work that we've already done related to this, it really supports our work. But we're going to be further building on that and further focusing on young people with specific experiences throughout the course of our center. Finally, we take a participatory action research approach, and we put youth here in parentheses because certainly our activities are designed in collaboration with young people, but we have other perspectives represented as well. We have a family advisory board and what we call our multi-stakeholder advisory board. This includes service providers and policymakers, researchers, and others who professionally support young people with serious mental health conditions. And so the reflective collaboration piece really stems from this participatory approach where we're collaborating and partnering with people with lived experiences and others to make sure that what we're doing as a center is relevant and impactful to the highest degree that it can be. In terms of our center activities, we're going to give an overview of these in a minute, but there are 5 research projects that we'll be conducting over the next 5 years. We have a number of different dissemination activities that Kathryn will speak about more. So that's ongoing throughout the life of our center. We have 3 dedicated training projects and 2 different technical assistance opportunities. And again, we'll go into more detail about all of these in subsequent slides. And I'll turn it over to Kathryn for the first research project.
Yes, thank you, Liz. I hope everybody's still with us and has a really good sense of the motivating factors behind these proposed activities. And without further ado, we will now describe those activities to you and hopefully incite some excitement from you all. So the first research study, there are 5. The first research study is the preliminary assessment of effectiveness, implementation, and research feasibility of the BRIGHT intervention, specifically for BIPOC and economically disadvantaged high school students. I'll be leading this project with my colleagues shown here and some young adult advisory board members as well. Next slide, please. So I think we mentioned some of this already, but this project is motivated by the knowledge in the field that compared to their peers, high school students with serious mental health conditions struggle with lower graduation rates and high rates of absenteeism, school refusal, and unexcused absences. This program called BRIGHT is a short-term program for high school students with serious mental health conditions who are returning to school after extended absences due to psychiatric hospitalization or intensive outpatient therapy. And the Bright program already exists in Massachusetts. It was born in Brookline, Massachusetts, out of the Brookline Center for Community Mental Health, and it is implemented in most, I think, high schools at this point in Massachusetts, and middle schools and elementary schools. And I've been partnering with them for the last few years to standardize their implementation materials for this promising program. And during that time, they've expanded implementation of Bright beyond the borders of Massachusetts to other states. But what is important here is for us to consider is that we know that given systemic inequities and the widening what we call achievement gap, which is worsened by COVID, BIPOC students and those from low socioeconomic status backgrounds, low economic backgrounds with serious mental health condition have some of the highest needs and could be, again, most benefited from a program like Bright. So this is what we're going to do. We're going to explore the feasibility, the appropriateness, and the acceptability of Bright, specifically with this population, and also test its effectiveness. Next slide, please. So our research questions are aplenty. First, we're going to talk to existing schools who serve mostly BIPOC students or students from a low socioeconomic status background, to ask if and how they think Bright as an intervention right now needs to be adapted to better meet the needs of young people with serious mental health conditions from BIPOC or low socioeconomic backgrounds. And then we want to test it. We want to see if and how students do once they receive Bright services, if their outcomes improve compared to those without Bright services. And this also helps us as a researcher kind of test the methods a bit. For your non-researchers out there, basically what that means is when you're doing a large trial of something, there's a lot of methodological decisions that go into that. And doing a smaller trial with fewer people will help you identify if and how you need to adapt your intervention and or research methods in the future. So we're going to do focus groups with existing students, families, and Bright coordinators. Then we're going to adapt the intervention as needed based on the focus groups. And then we're going to do this pilot feasibility randomized control trial. Here we are motivated by that quant crit movement to accelerate the development and adaptation and implementation of an intervention that has shown promise specifically for students from disadvantaged and marginalized backgrounds. Next slide, please. So what are we going to gain from this? Well, we hope to gain quite a bit. Mostly we will be gaining new knowledge about how Bright in its current existence in more than 200 high schools, I think it's closer to 300 high schools at this point, should be tailored to meet the unique needs of BIPOC students or those from low socioeconomic backgrounds. We'll have intervention materials that are ready for field testing, meaning we will have the methods ready to do a larger trial of Bright. And we will have preliminary findings. We will be able to make some preliminary conclusions about if and or how students who receive Bright seem to fare compared to students who don't receive Bright. So it's really exciting, and the study is really starting full throttle in the fall, and we will be keeping you all posted on what we learn as we go. Liz is going to take the next study.
So this next study is called the Development and Pilot Evaluation of Flexible Living and Optimal Wellness, FLOW, an intervention to support the social integration of LGBTQIA+ young adults with serious mental health conditions. This is a project that's led by Dr. Megan Kelly in collaboration with her colleagues, Dr. Ethan Moitra, Dr. Akiko Masuda, and Dr. Michelle Munson. In terms of the need for this study, we know that, again, young people who identify as LGBTQIA+ are at increased risk for mental health challenges due to negative social experiences such as marginalization, stigma, and discrimination. We also know that they're more likely to experience difficulty finding safe communities and developing social connections with people who are supportive. Um, Fortunately, there are interventions, and acceptance and commitment therapy, or ACT is an example of one, that are evidence-based and that, when appropriately adapted, could be helpful and well-suited to address the needs of young people with serious mental health conditions, especially those who are LGBTQIA+. So ACT is, again, an evidence-based intervention that has been around for many years and has been studied in multiple contexts with multiple populations. And the idea behind ACT is that it helps an individual to commit to positive behavior change that's consistent with their personal values, helps them live out their life values, despite experiencing negative or challenging thoughts and emotions. So in this case, ACT would serve to support young people with developing social connections, finding safe communities, finding ways to manage stigma, discrimination, marginalization, those negative social experiences, and live out their life values. So this study is going to involve the development and adaptation and pilot evaluation of a novel intervention called FLOW, again, to improve social connectedness and mental health in this young adult population. FLOW is an identity affirming adaptation of ACT, and specifically ACT Social, which was a intervention developed by Dr. Kelly to help individuals who have experienced interpersonal trauma to increase their social connectedness with family members, friends, and peers. The project is going to assess 3 primary research questions about the preliminary impact of FLOW, acceptability, so how well do young people like it, is it useful to them, and the feasibility of FLOW. And we're going to assess it across 3 different phases. So first will be an intervention adaptation phase that will be done in collaboration with LGBTQIA+ youth. There will be an open pilot trial and then a pilot randomized control trial, which will compare FLOW to another intervention called person-centered therapy. This is a common intervention for people who experience interpersonal difficulties. So we'll not only know a little bit about the feasibility of implementing FLOW and conducting research related to FLOW, but we'll also be able to gather some preliminary data about how it compares to other interventions. As a result of this study, we will have important new knowledge about how interventions like ACT that have been around for, again, a number of years should be tailored to meet the unique needs of young people who are LGBTQIA+ and experience significant mental health challenges. We'll have intervention materials developed in collaboration with youth that are ready for field testing and ready for use in larger research trials. And we'll have preliminary findings, again, to support larger research trials and implementing this intervention more widely in the future.
Hey,
I think Kathryn was going to talk about research project 3.
All right. So the third research project is led by my colleagues here at UMass within the Law and Psychiatry program, Gina Vincent and Spencer Lawson. And it's titled Improving Implementation of Risk Need Responsivity, Service Accessibility for Justice-Involved Young Adults with Serious Mental Health Conditions. Next slide, please. So risk need responsivity is a proven method to help justice-involved youth with mental health challenges participate in the community and reduce justice system involvement. Essentially, risk need responsivity stands for this idea of assessing a young adult's risk for reoffending and associated needs and responding to those needs by matching them with services to meet those needs. So in theory, sounds great, right? However, in practice, implementing R&R can be difficult for a variety of reasons. And mental health services alone do not significantly reduce justice system involvement. And limited availability of services can also be an issue, particularly in rural areas. So this risk-need responsivity model is in effect in wide swaths of the country. But it's just, there are barriers to its implementation, but it's the best of what we have. But we know, and again, that justice system involved youth, face a lot of challenges when it comes to reintegrating in the community. And again, this project is helping us understand that the system is something that actually needs attention, not just the young people themselves. So this study will explore barriers and barriers and feasible solutions to implementation of the R&R model, specifically related to need to service matching. Think about it. If there's no services in the community, that's going to be a problem. If those services are riddled with barriers to access and long wait lists, it's just really easy to start thinking about where and how these barriers might exist. So the proposed research here is going to ask, what are the current gaps in need to service matching? What are the implementation barriers and facilitators to need to service matching? What are feasible and acceptable solutions for improving need to service matching? We don't want to just catalog all the problems. We want to be thinking creatively and finding ways to overcome some of those barriers. And then we are also looking at what and how these questions might vary between rural communities and more urban communities. So the activities that will lend themselves to answering these questions will involve focus groups with justice-involved young adults with serious mental health conditions who are participating in risk-need responsivity programs already, and existing program staff from those programs. Again, we have 2 sites in mind. I think it's Indiana and Massachusetts. So doing a rural and urban kind of comparison there. And again, not just focusing on barriers, but also on solutions. We know pockets of creativity exist across the array of services, and finding and identifying some of those solutions that are already at play or could be is really what we hope to get out of this study. So if the next slide, I think, summarizes that as a result of this study, we will have new knowledge about how some key systems and policy barriers factor in here, but more importantly, what are some of those feasible solutions for overcoming implementation barriers in both rural and urban settings. So we're super excited to be working with Gina and Spencer on this project that will start in the fall. Liz?
So our 4th research project is called Leveraging Integrated Data Systems to Elucidate Relationships Between System Involvement and Community Participation Outcomes Among Young Adults with Serious Mental Health Conditions. This is a project that I'll be leading in collaboration with some colleagues at Temple, Dr. Katarina Roman, Mr. Eugene Brusilowski, and Dr. Rakai Usel. So young people with serious mental health conditions, as many of you probably know, are more likely to have system involvement in the child welfare system, the justice system, and certainly the public mental health system, and to use expensive services such as inpatient psychiatric hospitalization. System involvement also, as many of us probably know, can have a negative impact on community participation, especially employment. This is an area of participation that needs to have some maintenance over time. And when there are interruptions due to hospitalizations and other things, that can significantly impact the ability to maintain those areas of community participation over time. So in order to support young people better who do have system involvement, we need a better understanding of the characteristics of young people who are most at risk for negative employment outcomes. And so this is really the idea behind this research project. We're going to be using Washington State's integrated data system data. This is an administrative data set that includes over 2 decades of cross-system data for persons that are involved in state departments with state service providers. And we're going to be using this data to explore patterns of system involvement over time and their relationship with later employment outcomes. So we're going to assess whether there are distinct longitudinal trajectories or kind of patterns over time of involvement in the child welfare system, justice system, and public mental health system. We're specifically interested in patterns of system involvement prior to the age of 21 years. Around the age of 21 is when some system involvement does tend to fall off, such as, foster care system involvement, for example. So we thought 21 years was a good sort of reference point for this. We'll also be examining between group differences among different members of these trajectory groups in terms of characteristics of the system, setting, demographic characteristics, such as race and ethnicity, and clinical characteristics, such as specific mental health diagnosis. And this, again, is to get a better sense for who might be at greatest risk and who might belong to these trajectories over time of system involvement. And then our goal is to really see whether this has later impact on employment outcomes. For employment outcomes, we're going to be looking at things like employment status. Are people employed, yes or no? How many jobs do they have over a period of time? What do their earnings look like? And we're going to be looking at the period of time between 22 to 26 years of age, so later in young adulthood. And to accomplish this, we're going to use some advanced statistical modeling techniques to profile these trajectories of system involvement over time. This project is going to result in a couple of really exciting things. First, we'll have new knowledge about these long-term patterns of system and cross-system involvement, which ultimately will help us better improve services and policies. So there's better integration of systems and better support for these youth. We also, in addition to producing products like scientific research articles, we're going to work with our Young Adult Advisory Board and perhaps some of our other advisory boards to develop a brief on implications of these findings for services, systems, and policy. And then finally, because these integrated data systems are really an underutilized resource, we feel that this project is going to serve as an important blueprint for other states who may be looking to use integrated data systems for purposes like these.
Thanks, Liz. Acknowledging we did get a question in the chat that I think we'll just hold for the end. Mindful of time, we're going to try to get through the remainder slides quickly, so we do have time for some discussion. But here's the last research project that I'm honored to describe, which is the community participation since the COVID pandemic, a mixed methods study of the conceptualizations and experiences of young adults with serious mental health conditions from disadvantaged backgrounds. I'm co-PI of this study along with my colleague Alicia Luckstead from University of Maryland. Liz is a co-investigator, and Dr. Eugene Brusilovsky is another co-investigator as well. Importantly, not featured on that slide because they have yet to be determined or identified are two co-investigators from our Young Adult Advisory Board, who we will partner with in equal ways to oversee this project. This project was conceptualized in full partnership with our Young Adult Advisory Board. When Liz and I were writing this last summer, we met with our Young Adult Advisory Board, our National Young Adult Advisory Board, every week. And not only was it something that we looked forward to every week, but we just had such rich discussions and really wanted to give them ownership of one of the research projects here, which is how this project was born. And I'll also just say we have since doubled the size of our Young Adult Advisory Board, I think, or pretty darn close, and have increased its membership to reflect the diversity of lived experiences that we want to have represented. And we've done the same for our Family Advisory Board as well. But essentially, I'm not going to get into this too much. We already covered this. What we know about the community participation pre-COVID and the fact that we don't know a lot since COVID. So this study is going to provide us an updated understanding of what community participation looks like since the COVID pandemic. This information could be invaluable to designing interventions, systems, policies that meet the current experiences and needs of young adults. Next slide, please. So the research questions we identified with our Young Adult Advisory Board were twofold. This idea of like, what is community participation? Because I gotta say, some young adults on our advisory board were like, what does that mean? It is an academic-y kind of term, and maybe not the most youth-friendly. So we really want to talk to young adults to understand how they conceptualize community participation and how they experience it. And we also want to capture to what extent are they participating in certain areas that are important to them since COVID. So we're going to do 2 mini studies here. The first is a qualitative interview study with about 40 young adults representing our target population, asking them about the meaning and experience of community participation since COVID. And then we will follow that up with a larger survey that will allow us to measure community participation among a larger group of young adults. As kind of an example of how young adults infuse our work, you'll notice that we are specifically using the term since COVID. We got feedback from a young adult staff member with lived experience in early discussions about this project that young people and maybe older people who are suffering from long COVID actually do not like the term post-COVID. And it's true, we don't have a marker for the end of the COVID pandemic. It is debatable in some ways, depending on if you're looking at the national guidance from WHO or the CDC, et cetera. And that this since COVID terminology was much more sensitive and relevant, especially to youth who are still experiencing long COVID, which is also part of what we're going to be looking at in this study. Next slide. So as a result, we're going to, like I said, have we're going to have trainings and ongoing support to young people. So let me just say this. Hold on. From the study itself, we're going to create new knowledge that is needed to better develop interventions, policies, systems, and services that can serve the community participation needs. If we don't know what it is, we can't improve it, right? But we're also, through this project in collaborative nature with the Young Adult Advisory Board, conducting several trainings and offering ongoing support to young people involved in the Young Adult Advisory Board to foster their involvement in research as interviewers, data analysts, and co-investigators. And from our experiences, we can help other researchers learn to do that in their own research as well. So next slide, please. All right, we're going to wrap this up talking about knowledge translation, training, technical assistance. So we appreciate you all hanging on from here. So knowledge translation, bit of a funky term, again, maybe not used in everyday language, really is about how we take the information we're creating, the knowledge, and translate it, disseminate it, share it with people in an ongoing way. So our dissemination efforts are built on the leadership of Marsha Ellison and Deirdre Logan in terms of our existing infrastructure for communications, but this is going to be us disseminating information in all sorts of ways. So I have a couple questions for you guys coming up. In here, in the chat, and through the end of this webinar, we would love to hear what topics do you want to learn more about or hear more about when it comes to community participation among young adults with serious mental health conditions. Throw it in the chat now or continue to think about it. If there's something that you want to learn more about that we've covered here, we would love to find ways to share out more information. We'll be doing that through multiple ways. We will be attending the researcher conferences and the service provision conferences that are held nationally and regionally. We'll be publishing in peer-reviewed journals, but our main emphasis is always, our goal is to get this information out in more diverse formats to the people whose daily lives are affected by this, young adults, family members, service providers, etc. So we do that through electronic media, social media, podcasts, written blogs. We do tip sheets and briefs, all sorts of things. I'm going to go to the next slide, which is going to just show you some of these amazing products that we've created here at the Transition Center. And I'm also going to ask Dee to launch the second poll to hear from you on which modalities would you like to get this information in. So again, are you more likely, or would you prefer to see this information packaged up as a podcast? Would you like to see written products, written blogs, newsletters? Give us a sense, because sometimes we're guessing. Not that we're guessing, we actually have professionals who are really monitoring the field, but as you can imagine, with technology advancing as quickly as it is, the field is always changing. And one size does not fit all. So we still know there are people out there who still really like having a piece of paper in front of them. And we have people out there who love to listen to podcasts. We have people out there who don't take information in really well when they're listening, and they need a webinar with some visuals. It's all preference, but you can check all that apply. And this will help us know if and how we could move forward with, which kind of things we should prioritize production of. Thanks for advancing the slide here. We do have, these slides will be available on our website. If you haven't checked it out already, you can find the Stay Tuned podcast out on Spotify or wherever you get your podcasts. We've got 2 great episodes already published from Young Adult Advisory Board members, Josh and Derek, who share about their experiences engaging in their community in person via salsa dancing and in the community in Miami, Florida. And for Derek, he was talking about online gaming as a way of forging social connections and meaningful supports through his life. So if you haven't checked those out already, we encourage you to do that, and also follow us on social media and via our website. Thank you, Dee. So here we are. Looks like, all right, more written products, or people like the written products. I get it. I'm a paper girl. So that's great. 76% would like to see written products. 55% enjoy the webinars. 32% podcasts. Great. And then written blogs, social media shorts, newsletters. Fabulous, fabulous. And to be clear, I'm not writing a blog for young adults right now. We're getting young adults to write the blogs. We're getting young adults to not only participate in the production of the podcast, but share their stories. So all of these things are done in partnership with youth and young adults. So thank you for sharing that feedback. We're so excited. Liz is going to describe trainings, and then we'll begin to start wrapping this up.
Forgot to unmute. So again, we have 3 training projects. The first one is called Fostering Disability Justice Leadership and Civic Engagement among young people with serious mental health conditions from disadvantaged backgrounds. This is led by Dr. Barbara Furman from Temple University in collaboration with her colleagues Aisha Nelson and Ethan Rodriguez. Civic engagement, as Kathryn mentioned earlier, is one of those areas of community participation that can be very important, but we know that young people from marginalized backgrounds do experience disparities in civic engagement outcomes. And so the goal of this project is to develop a civic engagement training curriculum specific to young people with serious mental health conditions from disadvantaged backgrounds to help them take action around social, economic, political issues, other issues of importance to them. This project, again, is led by Dr. Barbara Furman. She has a group at Temple University called the University Community Collaborative, and this provides a youth programming continuum related to civic engagement in Philadelphia. It's been in operation for a number of years, primarily works with high school students from marginalized backgrounds. And Dr. Furman and her colleagues, as part of this project, will be developing a more succinct training curriculum that we will prepare and implement. And again, the aim is to support young people with taking civic action. That could be advocacy, community organizing, voting, volunteering, and increasing relevant knowledge, skills, and behaviors in order to do these things. The program is first going to be implemented here in Philadelphia with a small group of young people. And then Barbara Berman and her colleagues are going to develop a train the trainer package that will be more broadly disseminated. For training project 2, this project is called Preparing the Next Generation of Healthcare Professionals to Promote Community Participation Among Young Adults with Serious Mental Health Conditions from Disadvantaged Backgrounds. This project is being led by Natalie Stolen from the Children's Hospital of Philadelphia, CHOP, in collaboration with Dr. Kathryn Burke from the Institute on Disabilities at Temple University. We know that there's a high level of comorbidity or overlap between young people with neurodevelopmental disabilities and serious mental health conditions, and that many healthcare providers are not adequately prepared to effectively support these youth with their community participation, especially those that come from additional marginalized or disadvantaged backgrounds. Fortunately, there are programs, LIND, which stands for Leadership, Education, and Neurodevelopmental and Related Disabilities, is a unique program which provides graduate level training to pre and in-service professionals from multiple disciplines. So that can include social work, nursing, psychology, occupational physical therapy, and it seeks to improve systems of care for youth with neurodevelopmental disabilities and chronic health, including mental health conditions. So this project will develop and implement a new training curriculum and new content related to promoting community inclusion among young people who experience both serious mental health conditions and neurodevelopmental disabilities and come from additional disadvantaged backgrounds. This is going to be implemented within the Children's Hospital of Philadelphia's LIND training program. We plan to partner with LIND Fellows to co-develop the curriculum. This is going to cover topics like what is a serious mental health condition, what are some examples of disadvantaged youth populations with serious mental health conditions, what are community inclusion and participation, why are they important? And again, it will be implemented with a cohort of CHOP LIND Fellows. This is also an exciting opportunity to prepare the next generation of healthcare professionals to promote community living and participation. And the goal here is to expand this training beyond CHOP. We do have dedicated support from the Association of University Centers on Disability, or the AUCD. They oversee all of the LIND programs throughout the United States. I believe there are somewhere around 60. And they've agreed to disseminate the training after the project concludes with all of the LIND program trainings. Project 3 is called Community Participation Story Slants, a train the trainer approach. This training project is being led by Dr. Gretchen Sneven and Ms. Kara Baker Short from Temple. And we're doing this in collaboration with Youth Move. So storytelling is or can be a powerful tool for people to be able to share their experiences around an issue and to inspire hope and new behaviors. And in the TU Collaborative, we have focused on community participation stories in particular. These are stories that can feature people's experiences of things like education, new jobs, growing independence, family and friendship relationships. And this project is going to support peer providers with learning how to tell their own stories of community participation, and then use this process to support the youth that they work with to do the same thing. So the project is going to involve adaptation of a pre-existing storytelling training manual that Dr. Sneathen and colleagues have produced. This adaptation process will be done in collaboration with consultants from Youth Move, and then the training will be implemented with at least 10 Youth Move chapters. The training materials will subsequently then be refined, and a train the trainer manual will be produced. Again, the hope is to allow more people to be able to use this approach in the future.
Thank you, Liz. Thank you, everybody, for hanging on. Just a reminder that if you have topics you want to learn more about from us, please put them in the chat. We've got some great suggestions there about how to advise young adults to avoid the stigma in work, but without disclosing too much. Annie said, how do we initiate changes in community? And I think that's something that we are interested in as well. And yes, clarifying that this project here, CIRC, has a young adult advisory board and a family advisory board made up of caretakers of young adults with lived experience of mental health conditions. And so within our larger center here at UMass, iSpark has a general adult advisory board, and Liz's center at Temple has other ways of infusing advisory boards and representatives into their work. So next slide, please. We just want to tie this up by prioritizing or highlighting ways in which we can partner with you all and or others in the field. We would love to partner with other researchers out there who are working on similar projects, if you're interested in working with us to address a sub-question of interest of any of our research projects. If you are interested in collaborating on additional new research initiatives, let us know. We would love to increase the field, and there is plenty of work to be done here to be shared. Similarly, if you are doing work or if you know of work that aligns with our mission, feel free to share it with us. We are hoping to kind of share out via social media and our website some promising programs that we know of. We would love to get suggestions for promising programs in the field that already exist to support the community participation outcomes of young adults. You can also request technical assistance from us to support this work. Our next slide, I think, talks about ways to reach out to us. First, I just want to define technical assistance. It's basically a way to approach us, to get guidance from us that is informed by our emerging research and ongoing research, or our extensive knowledge in young adult mental health and community participation that we possess, meaning me and Liz, but also our colleagues. So if you have a question, if you are looking for knowledge that you can't seem to find out there, you can request assistance from us. You can also request an opportunity to meet with our young adult advisory board or a family advisory board to gain their reactions, feedback, and input on any relevant ideas that you have related to the community participation. This could go for researchers who are trying to get some feedback on their proposed projects, service providers. Engaging young adults in service design and delivery is another great way. And we realize that not everybody has the infrastructure to support these advisory boards. So we are more than willing to share our resources with you. We would ask that you go through a light training on best practices of community engaged research to make sure that you understand the principles, but we'd love to have you. You can request TA through this link. These slides will be available online, so you can click on the link, but essentially you can visit us at umassmed.edu/transitionsacr/CIRC, and you can request technical assistance there. Dee just put it in the chat because she's always ahead of us. And then next slide is really lending into questions and discussion. But I do want to just make a quick comment to say, Liz and I are here, and that's who you see today. But the CIRC is a reflective collaboration between many, many players. So you saw some pictures of our investigators and colleagues. We also, again, have the Young Adult Advisory Board, the Family Advisory Board, and a multitude of staff supporting us in many ways who help make this webinar possible. Dee Logan, who's helping us behind the scenes, Kristen Roy Buchnowski, who is our project director, and Jonathan LaRue, who was so helpful in making this beautiful presentation slide today. So thanks to them and others, other members of our team for helping make this happen. So we have a few minutes for questions and answers. Liz, I saw some action in the chat that I haven't had a chance to catch up on. Do you have a question at the ready?
Yeah, I'm just going to go from bottom up. So Sarah posed a great question. Have you thought about mistrust about research participation focused on marginalized groups, for example, Tuskegee trial? Yes, and I did try to succinctly say this in the chat, but we are being very mindful of the importance of relationship building, the importance of trust building, and we do have plans for activities that we're going to be building in initially, and things that we'll be doing on an ongoing basis with all of our advisory boards to enhance our capacity to meaningfully partner together. So an example of that are having conversations about language, having conversations about decision making and power sharing, and really making sure that people are feeling like they have meaningful contributions that they can offer and can trust that their ideas are going to be honored. So I think this is a really important part of the work. I don't know, Kathryn, if you wanted to add anything to that.
Yeah, I would say I think that's a fantastic response. And I would say within our research projects, this is continually something that we are mindful of. And, you know, we take our informed consent processes very seriously and typically test and refine our informed consent forms and conversations in partnerships with young adults. And if possible, have our young adult staff members or YAB members who are involved in the research interviews conducting the consent, making sure it's in plain language, leaving time for questions, etc. It is a very important concern relative to all of this work, and one that we want to continually be mindful of across the board. So thank you for the question.
Yeah, I also wanted to acknowledge Rishab's comment. What are your thoughts on customized employment for young adults with serious mental health conditions? And I don't know, Kathryn, did you want to tackle that one?
I mean, I have opinions and thoughts, and I guess that's what's being asked. I mean, I think in some cases we know of some supported employment programs, you know, clubhouses and otherwise, where there are, you know, reserved and or created job opportunities specifically for young adults and or adults with serious mental health conditions, kind of carved out. Here in UMass Chan, we have a close relationship with a clubhouse in Worcester, and the university has several of these kind of supported employment positions, and then more integrated employment opportunities as well. I think in some cases it is beneficial to have some of these positions carved out. In my opinion, young adults with serious mental health conditions are fully capable in most cases of thriving in general employment opportunities if supported appropriately. It's going to vary, but I will say within our center, we have been employing young adults with lived experience of mental health conditions for almost 15 years. And I have spent or been involved in the supervision of those young adults for many, many years. And I would say the significant number that we've dealt with very few issues, if you will, or challenges, and those that we've met with are really about young adults being new to the workplace and being new to an academic research institution, and really relative to their developmental kind of capacities as a young adult. It has very little to do with symptoms of their mental health conditions. And I wrote an article based on my dissertation on barriers and facilitators to continuous employment among young adults with mental health conditions after interviewing almost 60 young adults. And it really sounded like if they have supportive supervisors, if they have some flexible arrangements in work, if they have, you know, ability to flex their schedule, things like that, those things are really going to help support them. So those are, again, my opinions, not necessarily the same as Liz and not necessarily endorsed by our funders.
I see Rashab also added, please share your thoughts on women and men with serious mental health conditions living under long-term institutional care. I think this can be a significant challenge, of course, to community participation when people have been chronically institutionalized in inpatient settings or residential settings where they do have restricted decision-making options and ability to carry out community participation goals that they may have. But we also know from deinstitutionalization data and other data that even young people, even individuals who have been chronically institutionalized can have success and perhaps are more successful than some might think when it comes to community participation. As Kathryn was talking about, it's critically important that we provide the appropriate supports to address people's needs, especially as they're transitioning from these kinds of settings to their communities. But with those proper supports in place, many people can be successful in employment and education and those other goals. And also, a lot of those things can start prior to discharge. We can support people in connecting to educational institutions, for example, online. And there are other kind of tangible things we can do to support people and prepare them for the community, even in those settings.
Yeah, I would echo that. You know, in the United States, there was this deinstitutionalization movement in the 60s and 70s, where there was a large movement and push towards community-based mental health. But there are several conversations, especially within sociology of mental illness, about the failures of that deinstitutionalization and the unfulfilled promise of community-based mental health. So there's much more work to be done in the systems here in the United States. And again, in my research with young adults with mental health conditions, I was astounded and continue to be astounded hearing how common it is for even short-term institutionalization or short-term inpatient hospitalizations, never mind the experience of waiting in emergency departments for days, etc. So just to say, it is not like, oh, we tackled that 50 years ago. We still have a lot of work to do. And, you know, I think Liz and I felt we could probably come up with projects for enough of the 3 of these centers. And there is a real question there about how connections to the community are built when someone is leaving long-term institutionalization, regardless of if they're a 22-year-old or a 62-year-old. I think there is more work to be done there. All right, so I'm being mindful of time, just catching up on the chat. Yes, reunification with family, holistic care, this kind of, we call it wraparound care here. I mean, I'm still hearing stories from, you know, anecdotal by all means, but people being, you know, discharged from inpatient units with very little on, you know, literally few possessions, not a lot of care coordination is the word I was looking for. In principle, the care coordination exists, but I think in practice, it's really a challenge. We are so appreciative of everybody who joined us today, everybody who's listening, everybody who participated in the chat and the polls. Thank you so much. Dee has reminded us we will be posting this webinar and circulating it via an e-blast. So if you're not receiving our electronic communications yet, we encourage you to do so. And you'll be hearing more from us. So we really feel like this is a launch of our center, an introduction, if you will. And we hope to come across you all in the future. Liz, any final comments?
Just say thank you all for your participation today. And I also am excited to share back what we found from these projects that we've talked to you all about and continue the conversation.
Thank you. Thank you, everybody. Have a great rest of your week.